My name is Rebecca Hasson, and I'm an assistant professor in the School of Kinesiology and Public Health with an emphasis in movement science and nutritional sciences. And my primary research focus is childhood obesity, focusing on nutrition, physical activity, but not only those health behaviors, but what are the factors that shape those health behaviors. So a lot of our research focuses on the built environment, social environment, cultural environment, and how those impact children's health. So one of our projects that has received a lot of traction and that we're really excited about is our active class-based project. It's very multidisciplinary, so it involves the School of Public Health, the School of Kinesiology, and the College of Architecture and Urban Planning. And it's 3 different fields coming together to try to answer or solve the problem of childhood obesity. Again, we know that physical activity is starting to fade out of schools with PE and recess going away. And we're trying to figure out what are effective ways in which we can engineer physical activity back into the school day, not only on a playground setting, but can we actually put it in the classroom? We know that children, particularly between the ages of 6 and 10, primarily like to exercise in these, or they move in these patterns that are more bursts of energy rather than this slow, constant, steady on the treadmill for 60 minutes. So can we take advantage of their natural activity patterns by infusing physical activity throughout the day? There's 2 primary questions that we're trying to address. What is the minimum dose of activity or exercise that we can put into a classroom setting? And the second piece of the question, and this is where architecture comes in, how do you design that space that is conducive for physical activity? So if you are going to do high intensity exercise in small bursts with 20, 30 kids and an instructor, what does that room need to look like so that children don't get hurt, so that they still find it fun and enjoyable? And so that's where architecture is, assessing different models of classrooms, different floor plans that would emphasize movement and learning, because you don't want to disrupt the learning process as well. So those are kind of the multidisciplinary questions that we are addressing. We've started to also partner with the School of Education, and again, understanding that the primary reason why children are in school are to learn, but how can we also create an environment that promotes movement and learning and positive behavior outcomes? Some of the key findings that we have found with our research, with the active class-based research, has been that children do enjoy doing small bursts of activity. So we had our children, when they came into the laboratory and we did our pilot studies, irrespective of intensity, the children rated the activities enjoyable, even more so than when playing the sedentary condition where they played on a tablet for 2 minutes at a time instead of exercising. We also learned that when we infused or had the children do high intensity activity, it also stimulated additional activity. They wore an activity monitor for 3 days post coming into the laboratory, and instead of the kids becoming a couch potato, they actually became more active and did more physical activity. So if you introduce physical activity in one domain, they're more likely to also increase physical activity in another domain. We can change what physical activity looks like, that it needs to be enjoyable, but there are many different ways in which you can infuse physical activity in a school day. So although PE is going away, and although teachers really don't have the time or the space to block off 30, 45 minutes for physical activity, there are innovative ways in which you can infuse that physical activity throughout the day. Now we know that kids are growing, so we don't necessarily want the children to lose weight, but we do want them to have healthy weight gain as they continue to increase their physical activity and eat a healthy, nutritious diet.